All right, perfect. All right, so starting off with the first question, what made you want to become a PA?
So I would say I've always had a desire to serve, even as a middle schooler and a high schooler. I was involved in a lot of clubs and extracurricular activities that involved going out into the community and helping out the community. And as I got older, I think I was really drawn to becoming a PA, mostly because of the flexibility. I do feel that in general, this is a big generalization because I do know a lot of PAs who work just as hard or harder than a lot of their physician colleagues, but in general, PAs have a more flexible lifestyle.
Mhm.
Um, they see less complex patients and there's more flexibility in their work hours. So that's why I chose ultimately between medical school and PA school to become a PA.
Great. All right, next question. What drew you to practice in primary care?
So honestly, I had to in the beginning because of the scholarship. I was an NHSC scholar, and so I had to practice in primary care somewhere, inner city, rural, or IHS. And so that's why I started in primary care, and I've stuck to it. This is my 10th year now, mostly because of the variety that I see in clinic. I see a wide age range. From newborns all the way up to geriatrics. And I also see across all the different fields of specialties. I see psychiatry. I do some psychiatric care here. We are an IHS clinic, and so a lot of the times we end up being an urgent care center because a lot of our patients come and they need to be seen here because they can't get a ride to the ER or the urgent care. So I really like that variety.
So you mentioned the National Health Service Corps at the top, and I think that's really sort of like a common story that we hear with folks who maybe didn't think about practicing in primary care, but really saw through the opportunities offered by the program themselves in their career. So switching to talk a little bit about the NHSC specifically, how did you first learn about the National Health Service Corps, and why did you ultimately decide to apply?
So my first semester of PA school, the director of our PA program told us about it, and he encouraged us to apply. I went to PA school in La Crosse, Wisconsin, and that area is surrounded by a lot of urban or rural clinics. And so it made sense that we would be a program that would recruit PAs who would want to work in the rural clinics. And for me, it just made sense because when I learned that it would be a program with a scholarship that paid for my tuition, my room and board, a living stipend, and that it would allow me to go work in an underserved area, I was really attracted to that. I I personally come from an underserved community, and so I've always thought that I would go back and work in an underserved community.
Great. Moving on to some of the more technical sort of aspects of the program, can you describe what the application process for the NHSA was like?
Yeah. So it's a little foggy for me because it's been 10 years now, 12 years now since I applied, but I believe it was an online application and it was really straightforward. I answered some questions, some simple demographic questions, and then I had to answer questions regarding my record of service with underserved communities. And I had to obtain some letters of recommendation. And one of them came from my director of my PA program, of course. And it was all done online. And we heard, I believe it was within a couple of months, we heard if we got it or if we didn't get it.
So building upon that, what advice would you give to students interested in applying for the NHSC today?
I think that if you understand um, if you understand what the scholarship is, if you understand kind of the mission and vision of the scholarship of HRSA, then, and you think it aligns with your own goals and values, then go for it. Because in today's age, you know, where college costs so much, getting a degree, a master's degree, a bachelor's degree costs so much, and we're spending most of our adult lives paying it off. Why not go for it, right?
Absolutely.
That's my advice.
Absolutely. A couple more technical questions. Can you describe the process of finding an employment site to fulfill your service commitment?
Yeah, so my second year, which was also my final year of PA school, then I was connected with a regional site representative for the NHSC. And I believe he was based out of Chicago. So we would email back and forth, and he kind of showed me, or he kind of told me the process of what I would need to do to find employment and to get ready to do to serve my commitment. So I got into an online portal, and on this portal, you could look up sites based on state. So if you knew that you didn't want to practice in Wisconsin and you wanted to look at California, you could look at California sites. Or if you knew that you absolutely wanted to do inner city or rural, then you could look at these sites based on that. And each site had a HRSA score. And so you could look up sites based on their scores as well. If you knew that your particular scholarship required you to be in a site with a HRSA score that was higher than 18, for example, then you had to filter out in that way to find a site that would work for you. And once you thought that a site might match well with you, then it was up to you to reach out to them, mostly through email, to see if they were hiring and if they thought you would be a good match. And if that site did think you were a good match, then they would reach out to you or reply back, and then an interview was set up. And that's how I did it with my site here. I found them on this portal. I reached out to HR through this portal, and within a couple of days, they reached out to me because they were looking to hire either a PA or NP at that time. And so we set up an interview, and for me, fortunately, it was really fast. I came here, I really liked the site. I met the director, and I had a really good vibe about the program or the clinic here. And so I was very fortunate. I took this job as my first interview ever. So it worked out really nicely.
Great. So for the next one, you touch on this a little bit, but I'll just read it as is and see if you have anything else to add. How did you interact with HRSA while you were in school? And then how did that change once you began your service commitment?
So in school, if I recall correctly, every semester I just had to hand in or submit somehow my my tuition bill for that semester. In PA school, we also had classes throughout the summer, and so then your summer school, you also handed in that you somehow submitted that tuition bill. You also had to have a letter of good standing from the university where I was at, and so somebody in admissions wrote that for me once a year, I think. So that's what was happening throughout school, how they kept track of whether or not I was in good standing and how I was doing. And then once I started working, once I started my service commitment, I believe it was once every quarter that I would have to go into my portal, my online portal, and submit my hours worked. So if I took some days off, if I took vacation, if I was sick, I had to delineate, you know, the number of days that I was not on site. And HSC has some requirements as far as that, but it's pretty flexible. I think it kind of matches up with what you would do with a regular job. And so once I submitted my hours, then our HR person or the site representative here, they got an email link that they would click on, and then they would just verify that everything I submitted was correct. And that's what I did for my 2 years of commitment here.
Great. What would you say to a student or graduate who is hesitant about the service commitment due to salary concerns or the challenges associated with a patient population in an underserved area?
Okay, yeah. I guess in terms of the pay, I would say that for 2 years of schooling and free tuition that was paid for by me, books that were paid for, a living stipend that was decent, it was definitely worth it. I'm estimating that probably NHSC pay for about $50,000 worth of everything when I calculate everything up. And so that's a lot of money, right? And if I had gone to school and decided not to do this program, this scholarship, $50,000 to pay back would have taken me a really long time. I'd still probably be paying it back. And so maybe your salary may be a little lower. I'm not sure that it would be. I know for me personally, it wasn't. You know, I started with an average pay like most PAs coming out of PA school. And I would say, compared to some other new grads, I actually got paid much better. So it really varies from site to site. It's not a good generalization that if you do a service commitment inner city or rural or with IHS, you're inevitably going to be going for a lower pay. In terms of the patient challenges, I also feel like that's very much just a perspective issue. You know, you have professionals who would not work in peds, right? Like I probably would not want to work just with peds. There's clinicians who don't want to do psychiatry, and clinicians who don't want to do exclusively women's health. And so the idea of patient challenges, I think, is very much a perspective. I personally did not feel like this job and the patients here were quote unquote challenging or have been quote unquote challenging, not more than anywhere else. So I would say kind of know yourself, kind of know what you're interested in, and where you apply, kind of know what you're going into and make those informed decisions based on you.
Absolutely. So these last few questions are sort of just to reflect on the experience and sort of like the impact that it's had on your subsequent career post service commitment. So the first one is, what has been your proudest moment as an NHSC clinician?
I would say in the last year, Wisconsin passed a state law that has changed how PAs can practice in Wisconsin. And I played a small role in that. I went to the state capitol and I gave testimony on how it would impact me here at a federally funded IHS clinic. Specifically, this law, as it pertains to me, it's going to allow me to be able to practice here within my own scope of practice and my own training, and not based on my supervising or my collaborating colleagues. In the past, so if I worked with a doctor who wasn't trained to do endometrial sampling, then I could not do endometrial sampling, even though I have that training. Or if they did not do, what do I commonly do that they don't? Joint injections. I commonly do joint injections in the knees and the shoulders and also in the elbows. If they didn't do that, then I couldn't do that, even though I have extensive training in it. And so this law changed that. And now, you know, we as a clinic, we don't have to be afraid anymore if we get a physician in who doesn't have my same training. And if they have training that I don't, then I can learn from them and I can start practicing using those skills. And if a new physician comes in who doesn't have that training and I have it, I can continue to give it to my patients. And that's been huge for us.
And then the next question is, what skills have you gained from your service commitment, and how will these skills benefit you throughout your career?
So I would say that because we are rural and we are IHS, I have had to learn skills that I normally would not have if I was in a primary care practice in a bigger city. Specifically, I had mentioned that I do joint injections and I can do endometrial sampling. I can do some walk-in eye traumas. There's a whole bunch of stuff that I think I normally do that if I worked elsewhere, I wouldn't do. If I saw them, I would probably just refer them on. A woman with heavy menstrual bleeding, I'd probably get an ultrasound and refer them on to OB-GYN to take care of. But because of where I work, I do have to do the bulk of a lot of workups before I send them on. And that has somewhat to do with the fact that we are limited in resources here. The clinic is ran on some federal money that we have to make last, number one. And number two, a lot of specialty clinics are in Duluth, which is an hour and a half away on a good drive. And so our patients, they either don't want to go because it's too far, or they don't have the resources to be able to go. And so I have had to accommodate this and do a lot more in terms of buffing up my own clinical skills. And that's been really good for me.
All right. And then the last question is, what has kept you practicing in an underserved community after your service commitment?
Our clinic is small and we are a community health center. And so I feel like we are not as profit driven here as we are elsewhere. I feel like I come in and I'm here to see the patients and to serve the patients. And it's not so much about seeing so many number of patients a day, which is important to me. The other thing that I would say has kept me here is the weight that I have with the clinic and with the tribe. My advice, my recommendations, they go a long way. I'm not just a number, I'm not just like the 100th PA and the big healthcare system that I work for. I serve in committees that help make policies and protocols for the clinic. And so I play a really big role in shaping my clinic and how we give care to patients, how I myself practice. And that's really important for me.
All right, perfect. Well, that wraps it up. So I'm going to go ahead and stop the